Welcome to Breakdown Episode 5. So let me ask you a tough question. In a medical crisis, when you literally can't speak for yourself, who does? It's a question we all kind of push to the back of our minds, hoping we never have to deal with it. But in this explainer, we're going to look at why having an answer is one of the most important things you can possibly do for yourself and for the people you love.
You know, for so many families, the story starts exactly the same way. A sudden illness, a bad accident, and then a call to 911. And that single, simple action, it sets in motion this massive, complex system that has one primary goal and one goal only: to save a life.
This quote from a healthcare professional just nails the relentless forward momentum of emergency care. The second that 911 call is made, the entire system is designed to just go, to push forward, to intervene, to act. But what happens when all that momentum slams right into a person's deeply held personal wishes?
To really get that collision, we have to first understand how the system is even built. You see, it has a default setting, and it is absolutely crucial to know what that is.
Okay, the key phrase here is single structural system. What does that mean? Well, it means there isn't one 911 for comfort care and a different one for a heart attack. The emergency medical system, or EMS, is built for one thing: aggressive, life-saving intervention. That's the default.
Right from the training that first responders and paramedics get, all the way to the protocols in an emergency room, the whole structure is built for immediate action. The number one priority is to stabilize the patient and get them to the hospital. Now, don't get me wrong, it's an incredible system for saving lives, but it also means that all the nuance, all the personal context, can so easily get lost in the rush.
All right, let's follow that path. Let's see how this momentum just keeps building as a patient goes from that initial crisis call deep into the heart of the hospital, the intensive care unit.
Think of it like a river with a really powerful current. That 911 call, that's where you get in the water. On the scene, the paramedics are pushing you along with aggressive care. Then you hit the emergency department and that current gets even faster. By the time a patient makes it to the ICU, they are on this well-worn path of maximum intervention.
And this is where the real problem starts to creep in. The system is just moving so fast, with so many people laser-focused on immediate medical tasks, that the most important question of all, what would this person actually want, can get pushed further and further down the line, sometimes until it's too late.
So, let's see how this actually plays out for a real family. This is the story of a daughter trying with all her might to be her mother's voice when her mom couldn't speak for herself.
So the daughter, who happens to be her mother's legal power of attorney, shows up at the hospital. She thinks she knows exactly what her role is. She's there to be her mother's advocate, to communicate the wishes that her mother had clearly, explicitly told her. She is there to be her voice. Simple, right?
And then this absolutely devastating response. It's a total breakdown in communication. The physician, who's operating from a place of duty to save the patient in the bed, hears the daughter's words not as advocacy, but as interference. So the big question is, why? Why does this happen?
Well, it really comes down to two totally different perspectives. It's like they're speaking two different languages. The family sees the whole person, their history, their values, what made them who they are. The physician, on the other hand, is trained to see the immediate medical crisis right in front of them. They aren't enemies, they're just operating in two different worlds, with two different, and in this case, conflicting sets of duties.
Now, this exact conflict is why we have tools for planning ahead. So let's take a look at the promised and, as you'll see, the very real problems of the main tool that's supposed to prevent these situations from ever happening.
So what is an advance directive? Basically, it's supposed to be your voice, in writing for when you can no longer speak. It's a legal document created for one specific reason: to protect your right to make your own decisions, even when you're incapacitated.
Usually, it has two key parts. The living will is basically your list of what-ifs. It's the instructions for your care, the what. But you could argue that the other part is even more important. That's the healthcare proxy, the actual person you choose to interpret those wishes and make the tough calls in the moment. That's the who.
You know, this has been a long time coming. The whole idea of legally protecting a patient's wishes is pretty new, really starting back in the 70s. By the 1990s, it was federal law that hospitals had to ask you about these things. And now, the thinking is evolving again, because we're realizing that the piece of paper itself just isn't enough.
And here is the big twist. Despite all this legal history, all this good intention, study after study shows that just having an advance directive often doesn't actually change the care a patient gets in a crisis. So why is this supposedly powerful tool so often useless?
Well, the reasons are just frustratingly practical. The document is sitting in a safe deposit box when the ambulance shows up. Or the language says something like, no heroic measures. But what does that even mean when a specific treatment might offer a 20% chance of recovery? Or maybe a family member faced with the awful reality of loss panics and just says, do everything.
But this next statistic is, well, it's pretty shocking. One survey found that a staggering 91% of healthcare workers didn't regularly check if a patient even had an advance directive. That just shows you this massive gap between the legal idea and the reality on the ground during a crisis.
So if the document by itself isn't the answer, then what is? Well, the research points overwhelmingly in one direction. Let's dig into the real path to making sure your wishes are actually honored.
Let's go back to the daughter from our story. This is what she eventually found in her mom's documents. See how it's not vague legal jargon? It's a clear, personal, value-based statement. That's the result of a real conversation. It speaks to what quality of life actually meant to her mother.
And this, right here, is the key takeaway of this whole thing. The legal form, the advance directive, is just a tool. The real work, the actual solution, is the conversation, the one you have with the people you love, and most importantly, with the person you choose to be your voice. So what does this all mean for you? Okay, 4 things. First, understand the system's default is do everything. Know what you're up against. Second, choose your proxy really carefully, not just who you love, but who can be a strong, calm advocate for you in a crazy situation. Third, have the hard, specific conversations. Don't just talk about treatments, talk about what makes your life worth living. And finally, for goodness sake, make sure everyone knows the plan and where to find the paperwork. We'll end with this question, because it's the fundamental challenge here. It's a challenge for patients, for families, and for the entire medical system itself. It's a question not just about medicine, but about what it means to live and to die on our own terms. And the answer, it seems, doesn't start in a hospital at all. It starts in our own living rooms, with the people we trust.